In here. Hello? Hello? Hi, guys. Sorry, that's my fault. I was on mute the whole time on Facebook. That's okay, because you guys didn't have to hear all the buzzing of my coffee. But do you guys know that fat, which is this one, my coffee, when you take fat, you better absorb your vitamins supplements. They need to be taken with fat. If you don't get absorbed easily. Like turmeric. If you want turmeric to be better absorbed, not only do you have to take it with curcumin, but you have to take it with fat. So I like to take my vitamins with my coffee. I get pre and probiotics. Sonny gets energy. So when he comes home, he just doesn't plop on the sofa. He gets to do things for the house. You know, a family of 8 has a long honey-do list. Okay, and adaptive for the both of us. It's a calming blend with wild orange, which is like my favorite, and coriander seed, fennel seed, lavender to just calm me down. Hi Julia, good morning. It's so cold. Just setting up Sunny's vitamins for him to take tomorrow. So whenever I set my vitamins, I set that for him so he could just gobble it up when he goes to work. And I was just explaining that fat taken with your vitamins makes our vitamins get in our bodies much better. So, can you hear me all right? Can you give me a thumbs up, Julia, if you hear me okay? So I'm reading from The Unbreakable Brain today because I found it and I'm so happy because I always say when I was going through this journey, I just didn't want to listen to Gundry, the heart doctor, right? I also wanted to listen to a diabetes doctor. And then I chanced upon the geneticist Sinclair. And what's the other thing that's a lot of us are dying from is Alzheimer's and dementia. So I wanted to listen to somebody that's focused on that and see what they said. Anyway, I was reading from this book and I got to about 1/4 and I lost the book. So I thought I just couldn't find it. Anyway, it was on the right side of my car. And since I don't get to use my car so often now because everyone's online schooling, I never really got on there. But Bailey's been driving and I got a chance to sit on the passenger seat. And lo and behold, it's there, my book on the door side. Oh, this is going to take a while. I'm not one of those pop everything and I'm a baby. Okay. Last. Oh, second to the last. Let me just hug this coffee. It's so cold. My hands are so cold. Normally, it itches when it's cold. Way back when I first started this adventure, this journey, this health to longevity journey, I used to have my extremities, my toes and my fingers itch when it's cold, and now that it's fall, it would come and it would be so irritating watching my kids play soccer early in the morning, and even if I'm wearing double socks and Uggs, it's still there. Anyway, so Unbreakable Brain, shield your brain from cognitive decline for life. Who gave this book to me? My neighbor. All of these books that I have, I didn't go out and buy them. Um, they were introduced to me. Chapter 3 is quite interesting. Let's go back. When I was reading it, I said, "Ah, you guys should know about this." Okay. Let me do chapter 2, like just skim through the titles. But this one says Alzheimer's, 1.8 million are men, 3.2 million are women. One in three senior citizens dies with Alzheimer or another dementia. 9% of Alzheimer cases begin at 60, and I'm nearing there. I'm 46, going to be 47 soon. 11% of persons 65 and older have Alzheimer's disease already. And 32% of the persons 85 and older have Alzheimer's disease. So 85% of Alzheimer's patients are over the age of 75. So this is important, especially for us women, that it's 3.2 women more than men, 1.8 get Alzheimer's. And the top keynotes are medical issues. When we have that, like diabetes, cancer, and heart diseases, we're more likely to get Alzheimer's. So heart disease, diabetes, depression, anemia, vitamin B12 deficiency. Of course, there's lifestyle and environmental factors and diet, stress, sleep. These are factors. Smoking, the lack of exercise. Ooh, I should be stretching as I'm reading this. Toxins. And of course, genetics play a role. But genetics is like we have a switch. It's there for all of us. Like I have the cancer and diabetes in my genes, but it's up to me to keep it or not. It's up to me to turn it on or not. Okay, now on to chapter 3. Did you know that prescription drugs could actually be a cause of memory loss or cognitive defects? There are tons of drugs out there that alter neurotransmitters, which cause problems with brain health sooner later. There are drugs that can deplete B vitamins, and there are others too. So B vitamins are very important, which because the depletion of that causes these things. Thank God I have all the Bs, B6, B12s, B8s. I don't know what all Bs, but I have all of them in my supplement. So it's the first thing in the morning I take. So it might not be you who is declining mentally, but your medications could be at fault. Before we go any further, it's important to reiterate that you should never stop taking your prescription medications without the express recommendation of your doctor. If you're one of these medications, or if you're on one of these medications, and think it would be having a negative effect, talk to your doctor, see what alternatives are available to you. We're gonna go snowboarding soon, so I'm trying to build up my thighs. Antidepressants. There are several different classes of antidepressants. These ones that seem to be the worst for memory function are tricyclic antidepressants. I might not be saying that right. Which include Sinequan, Tofranil, Elavil, Pamelor, Bivactil, Anafranil, Triavil, Ascendin, Limbitrol, and Norpramin. These drugs are anticholinergic, meaning that they interfere with acetylcholine, the most important neurotransmitter for thinking. So, taking the antidepressants actually affects our thinking. Just over half of the people taking these drugs will experience loss of concentration, and about 35% will say they have memory impairment. So, good morning, Luann. Um, so, taking antidepressants makes us, 35% of us, lose our memory. It's more than not finding your cell phone or your keys, right? Oh my goodness. So for the record, you don't need to have depression to be prescribed these tricyclic antidepressants. People who have eating disorders, chronic pain, menstrual cramps, obsessive compulsive disorder, and even hormonal issues like hot flashes can spur, oh no, your doctor to prescribe these medications. Oh my gosh. So I remember a friend of mine years ago was sharing with me that she couldn't take a hot shower because her skin would be itchy. Just like I couldn't take a cold shower because my extremities would itch, my toes and my fingers. And then later on, the skin in my thighs, right? When the cold water from the ocean would come in. And guess what the doctor prescribed her? Antidepressants. So she wouldn't feel that. Anyway, she didn't like it because it just made her feel, sleepy and non-reactive. But several years after she told me that, I experienced the itchy, and then I thought about it. Man, I don't want to go to the doctor for this and then have them prescribe me antidepressants. It didn't work for my friend. Why would I do it, right? But this doctor is right. You don't have to be depressed for your doctor to prescribe such things. Selective serotonin inhibitors are another common class of antidepressants, and these have been found to impair episodic memory, the memory of details of events in your life. Imagine losing that. I'm already happy because we can put post on Facebook or Instagram, and I have it in my access to my photos at any time, and I can share it with family and friends at any moment. I love having that memory. I don't remember every single thing that happened in my life, but even more we will forget if we take selective serotonin inhibitors. This is the exact memory you would use to write your autobiography. So these inhibitors also change the dendrite connections between neurons in your brain, especially in the cortex, which is our conscious thinking, a phenomenon that has been measured within 3 hours of the first dose of these antidepressants. or these selective serotonin inhibitors. If you recall from the beginning of the book, Einstein was a genius because of the tremendous connections in his cortex. While the drug companies go on about increased axon growth, one end of the neurons, they leave out this detail about the dendrite connections. So the more dendrite connections, the more better. The more we become like Einstein, right? Lithium, which is used for for regulating bipolar mood swings, is also associated with cognitive dysfunctions. So that's one. The antidepressants, which can be given to us even for hot flashes. Okay. Diabetes medications is next. Of course, we've already talked about diabetes. Remember, I mentioned it in chapter 2. Diabetes can lead to dementia. He's not the first doctor that we read that from. Diabetes can lead to dementia. Who are we reading from? The book before this. So we were working on Healing Oils of the Bible. Oh, you guys are walking?
No, we missed it.
Aww. Healing Oils of the Bible. And what was the other book? Go ahead. Let me jog my memory. They say when you completely forget, that's when you know you're losing your memory. But if you just relax and sip your coffee and still remember within like 5 minutes where you left those keys or whatever. Oh, I left water over there. Um, you're still good. That's normal. Losing your keys and finding it a couple of minutes later is fine. But like not remembering the entire day where you left your cell phone or your keys, that's the problem. Natural cures they don't want you to know about. That's the book you were reading from, right? That's Healing Oils of the Bible. They said that diabetes leads to Alzheimer's also, um, because insulin resistance, that's what they find in Alzheimer's and dementia patients. That's why they call Alzheimer's and dementia diabetes 3, because diabetes and Alzheimer's patients have insulin resistance. So one kind of equals the other, you know? That's why this part is so short. But some of the medications that reduce blood glucose cause cognitive decline all on their own. So metformin is one example, ostensibly by causing B12 and other vitamin deficiencies. Bye. Where are you going?
Work.
Oh, it's already almost 9. Oh my goodness.
Bye.
Bye. Have a great time.
Thanks.
Kiss all the doggies for us at Petco.
Okay.
All right. Let's get moving. So, this is what he was saying. Some medications can cause us to be deficient in B12. Cholesterol lowering medications. Oh my goodness. My dad takes Lipitor. I've been trying to get him off Lipitor for a long time. And he used to take it almost daily because he loves to eat. My dog's once in. And so I've been giving him 1 drop of grapefruit, lemongrass, and clove in a veggie cap twice a day. And then it's a play, Lipitor and that, until it's more of the essential oil than the Lipitor. Then less and less he'll need to take Lipitor because look at this, cholesterol lowering medications. Statins are notorious for causing severe memory loss. There are different types of statins on the market, such as Zocor, Crestor, Lipitor, Bravacol and Lescol. These drugs work by lowering the amount of cholesterol that is produced in the body. But although your doctor may think this is vital, there are some serious ramifications. For example, I know your liver, right, gets affected with Lipitor. For example, cholesterol is used in your body as a precursor compound for different hormones and even for a chemical your body synthesizes called dolicol. So we need cholesterol. This chemical is essential for your memory, but it doesn't get created when cholesterol synthesizes, synthesis is blocked. Cholesterol is also important for the connections between nerve cells. So by taking Lipitor, you're blocking the synthesis of that all working out. One University of California, San Diego study surveyed 171 patients between age 34 and 86 years old to discover how frequently memory and other cognitive problems resulted after taking statins, these Lipitor. 75% of them experienced negative changes in cognitive functioning. 75%, y'all. I don't want that to happen to my dad just because he's taking Lipitor. 84% of them stopped statin therapy, and 90% of them reported an improvement in their brain functioning within about 2.5 weeks. So just stopping Lipitor 2.5 weeks, my dad can already improve brain functioning. Some patients have had been diagnosed with Alzheimer's or dementia had their diagnosis reversed. That is so cool just by stopping, right? When was this book published? 2015. I know, and it's already 2020. And I'm just reading it now. Oh my goodness. Since 2009, the FDA has required statins to include a warning about possible memory problems. Okay, drugs to reduce blood pressure. I don't want to take up too much of your time, but it's almost 8:30. Beta blockers are commonly prescribed for congestive heart failure. I was born with a congestive heart failure, arrhythmia, high blood pressure, and fast heart rate, as well as migraines and angina. Did I say that right? Angina? 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 I don't know. So Lopressor, Toprol, Corec, Tenormin, Beta Pace, and Inderal are some of the more common ones. These drugs cause memory problems by preventing the neurotransmitters and epinephrine and norepinephrine from retrieving memory, especially in patients who already have some cognitive decline. OMG. Parkinson's medications. As a disease of the brain, Parkinson's is treated with many medications. I'm trying to do this while I'm stretching. Many medications that alter the production or elimination of neurotransmitters. Again, these are drugs that increase dopamine, specifically L-Dopa, Mirapex, Requip, Parlodel, and Apoquin, which is needed for thinking, pleasure, and initiation of movement. So it affects our wanting to move in the first place, or from having pleasure from eating food, which I love, and other things. Okay, there are anticholinergic medications, scopolamine, atropine, which block the neurotransmitters acetylcholine, inhibiting parasympathetic nerves impulses, but also directly impairing thinking. So other Parkinson's medications block COMT or MAO enzymes that break down neurotransmitters and keep the brain going. All these In other words, some of the Parkinson's medications handle a symptom while creating more cognitive delay. This is why Hippocrates said, let food be thy medicine, and let thy medicine be thy food, not these pharmaceuticals, right? And that's what that book that we were reading, um, what they don't want you to know about, right? Natural cures that they don't want you to know about. That book, that one I was trying to remember because I was reading, I'm still reading Healing Oils of the Bible, and I'm still reading. Um, I read that in bed, and then I'm still reading through Audible while I'm driving the Body Keeps Score. And then I found this, and I'm just so excited because I got to read this to you guys. Okay, next, narcotic painkillers. This is big because the list of narcotic is quite long, right? He goes on. What I see here is Vicodin. Of course, there's buterpanol, fentanyl, Demerol, all the things that they gave me while giving birth. Oxycontin, Avinza, Percocet, and Astramorph, among other things. Okay, there's a lot of the others. Are some of the ones that are commonly prescribed for use at home. That's why when I gave birth, even if they gave me Vicodin, I wanted to feel the pain. Not that because I'm sadistic or anything. It's just that, you know how you're trying to walk and you're trying to do the dishes and stuff right after giving birth. I would rather feel the pain than be on Vicodin, because the pain is a warning signal for me to go and sleep, go and rest, go and be with the baby. The dishes can wait. If I'm on the Vicodin, I can go, but the pain is a warning sign for us to hold on and stop. Yeah, big pharma, Julia says. However, the list doesn't stop there. There are also combination pain drugs that include narcotic ingredients. For example, acetaminophen combined with codeine to make hydrocodone or oxycodone, or aspirin and oxycodone mixed together to make Percodan. So all these things that we take, right? Narcotics are derived from opium, which acts on the nervous system by stopping your emotional reaction to pain and interrupting the flow of pain signals. See, pain is a warning signal. I don't want to deaden that. That book, Healing Oils of the Bible, says that pharma is like a lie. It's stopping you from feeling it, from feeling the emotional pain, the physical pain. Okay, so if you just came from I have two friends who just came from surgery. Take the painkillers, okay? But for chronic pain, I'm talking about that, to still continue to take it. There are other means of naturally um, helping us, instead of these things that have such major side effects, right? So again, interrupting the flow of pain signals, making you sleepy and unresponsive to pain. The pain is still there. This is what Healing Oils of the Bible was saying. It's still there. This is why it's a lie. But you become unable to care about it. Not only does it tell you, it blocks the um, physical so you don't feel it, but you also don't care about it. It also blocks the emotional part. If that is how you react to pain, just imagine how poor your focus on everyday tasks will be on narcotics. The result is a change in short term and long term memory. These are also addictive medications. Next is steroids. for our eczema, right? Or for the bumpy things that we get here from milk and dairy and all the preservative foods. You know, I used to have that chicken skin, right? Cortisone, prednisone, and anything else ending with "one" are the bad guys here. Steroids reduce inflammation using the body's stress response. And your brain experiences the same thing as when you are the most stressful situation for your life. Except that the chemicals, the steroid we put, are even more intense than your body can naturally make itself. Let's read that again because that's so very important. And I know steroids are just like coming off the shelves. Okay? Steroids reduce inflammation using the body's stress response. And your brain experiences the same thing as when you are in the most stressful situation of your life. So that's what the steroids, when we put it in our skin, it uses that stress response to that thing here in my skin, right? That's itchy, so that it can fix it. The one that's like fight or flight stress response, it uses my body's emotional and physical response to treat that. That's what the steroid does. Except that the chemicals, the steroids, are even more intense than your body can naturally make itself. So this is steroids cause mental conditions requiring treatment in 20% of those who take them. And 75% of those people feel some mental alteration that is relieved when the drug is discontinued. OMG. You know what helps? I remember Bryn running to me because she just had hives in her legs all of a sudden. And um, I just put lavender on it just to calm it down with some tea tree. Not even 1 minute, y'all. Not even 1 minute. Gone. Um, Normally, we treat those things with pharma, right? Um, so we already, next is antibiotics. We already talked about the fact that antibiotics cause inflammation, which is a possible cause of dementia. But there's a particularly nasty class of antibiotics in the market called fluoro, fluoroquinolones. Fluoroquinolones, which deserve a special attention. Avelox, Cipro, and Lavaquin are the three most commonly prescribed, but you can identify them with the suffix floxacin. There's a place for medicine. The book Healing Oils of the Bible was saying there's a place for medicine, which is emergency. Like, you know, you got into a car accident or you're getting a heart attack. Go with antibiotics. You know, we need to save lives. But we're talking about, again, I'm talking about taking antibiotics chronically because you are trying to treat something that keeps happening. Like the time when Saxon and Sabine kept getting sick when we lived in this two-bedroom condo on the 48th floor for 1 year in Manila. I had to keep them giving them antibiotics every month, and it was a cycle. Antibiotics, they get sick, their immune goes down, antibiotics. And that was the time where my mom introduced to me essential oils. That was back, what, Saxon 17 now? That was about 17 years ago. Ever since, I didn't look back. And I also got out of that place because there was no cross ventilation. So it's very important to open your windows one way and let the air go through in and out of your house so that there's fresh air going in, because you want the viruses and bacteria that are also cooped up in your home to go in and out. And you also want fresh viruses and bacteria to go in your home. I know it doesn't sound cool, but for us to bring stronger immune to it. That's why it's important to have animals also, because they bring in all that bacteria and viruses. So little by little, it's like we're being inoculated, you know? Anyway, antibiotics. Reactions of the central nervous system are common, which, with people self reporting memory loss, psychosis, and other issues like tingling, numbness, that was me, anxiety, dizziness, and more. This dizziness, yeah, this was me. This is in addition to other common and other severe reactions, which have included gastrointestinal problems. That's like all the stomach issues, tendon rupture, heart arrhythmia, which is heart palpitations, right? That was me, which is also affecting a lot of women who are pre and menopausal, and a whole mess of others. The reason is because of the addition of fluoride molecule, which helps the antibiotic permeate into hard to reach tissues. And here we are, we thought fluoride in our water was cool. Unfortunately, that also increases permeability into the brain and spinal cord. And fluoride, as we've already discussed, is a known neurotoxin. Generally speaking, these antibiotics are only prescribed in special cases and or as the last resort to kick infections that ordinary antibiotics can't reach. So I always tell the doctor my kids are allergic to penicillin because I don't want them to use the heavy stuff right away. Because the bacteria, they die, right? But there's like that percentage that lives and gets to know that antibiotics you just gave them and gets stronger. Um, this is why they were saying that when you give uh, to cancer patients, when you treat them with their, um, what is it that we treat chemotherapy, it obliterates the cancer cells, but there are some that remain and they become stronger, and then the cancer goes back even more with a vengeance because they got to know that drug that was introduced to them. And this is why they say one of the most dangerous places to be in are hospitals, because there's a lot of patients there that are they're treating with antibiotics, and there's a lot of patients that have bacteria that have mutated, that have gotten to know these drugs, right? And they're stronger, and we come in there, and if we get to that bacteria, we get even more sick because we've never had the bacteria that died or the new one, right? So that's why hospitals are super super dangerous. So generally speaking, these antibiotics are only prescribed in we already read that part. Okay, sorry. Next are antihistamines: Dimetane, Vistaril, Benadryl. Everybody knows that one. Chlortrimeton and Clistin are all antihistamines. You guys can still hear me. Let me just get my dogs. I'm gonna read as I walk. And who would think something as common as antihistamine could cause cognitive decline? Yet it does. Histamine is a neurotransmitter that the brain uses to cause wakefulness. Oh my goodness. Okay, let's go, guys. Bertram, who are you? Okay, dogs are in. Okay, so histamine is a neurotransmitter that the brain uses to cause wakefulness. We make it during the day to be awake and thinking. In local tissues, it causes increased blood flow and itchiness, like allergies and mosquito bites. In the stomach, histamine is needed. So we actually need histamine um, for stomach and acid to digest food proteins and minerals and defend us against bacteria, parasites, and fungi. So antihistamines stop all those functions, including wakefulness and thinking. They also interfere with acetylcholine, the primary neurotransmitter for learning and memory. Imagine giving antihistamines like Claritin every time we get allergic attacks to our kids or to ourselves. I mean, we're spending so much making sure they go to school, they learn what they learn, and that they retain what they learn, right? But by feeding them bad food, it negates it. By feeding them non-fat milk or the preservative foods, it just negates it. It's like having yogurt, right? It has the lactobacilli, but it also has the sugar. So it's just like a wash. Um, where was I going with that? So giving our children Claritin when they have an allergic attack or us um, is just negating it. So this guy was saying, going back to histamine, we need histamine. It's a neurotransmitter that the brain uses to cause wakefulness. We even make it during the day, so that we can wake up, so we can think. Um, in local tissues, it increases the blood flow or itchiness. Um, when we have an allergic attack, it causes us to feel itchy, right? Or itchy here. When a mosquito bites us, the histamine rushes there so that it's itchy, so that it can swell up and protect you. But antihistamine stop all those functions. Okay. So anyway, benzodiazepines. Did I say that right? I'm not sure. These drugs are prescribed for muscle spasm. Hello, I used to have muscle spasms. I had to go to the emergency and get a shot in my 20s. Seizure prevention, anxiety, irritability, and delirium. Anxiety and irritability, they calm you down, these benzodiazepines. Adaptive. This has lavender, wild orange, fennel, seed oil, coriander. Um, it also has ahi flower. But all food, guys, let food be thy medicine and let thy medicine be thy food. It's a calming blend capsule. It makes me not like sleepy calm. It makes me have the windows open, so to speak, where my possibilities would only be, let's say, one or two windows. But when I take that, I can, it's like all the windows in my house are open. Options are available. It's like for me cooking, instead of cooking just spaghetti for the kids, all of a sudden I'm like, let me think of something else like sweet potato gratin. I just came up with that um, one day and then looked up a recipe and I'm like, yes, that's what I was thinking. Anyway, there's something that I want to cook with coconut oil, a coconut cream um, soon. I'll share that recipe. Anyway, going back, Xanax. Sometimes benzodiazepines are prescribed for insomnia or depression. Xanax, Valium, Dalmane, Librium, Clonopine, Versed, Doral, Restorol, Halcyon, and Ativan. We've heard those before. Are in the first list of these drugs, but also consider Centrax, Serax, Paximam, Posum, Traxine, and Librax. Thanks for joining. Chakib. Okay, benzodiazepines cause memory loss by slowing down the activity in the brain that transfers information from short-term memory to long-term memory. Imagine giving this to our children. I have one child that has ADHD, and um, giving any of these Xanax, Valium, Dalmane for their, or Ativan for their, to calm them down. And then you're trying to teach them, you're trying to make sure that they retain what they learn in school. But then here we go. It inhibits the transfer of information from short-term memory to long-term memory. That's like school right there, right? So this is why anesthesiologists use them. So you won't remember how unpleasant surgery or any medical procedures are. Benzodiazepines should only be used for short periods of time. Oh, like when I'm giving birth and I need some pain. Yes, I had the spine blockers. I'm not a martyr. I wanted to, but when I found out how much pain it was, I'm like, okay. Benzodiazepines should only be used for short-term periods of the time, especially if you are elderly. Chronic use of these drugs leads to memory impairment, y'all. 2014 study showed that if you took daily doses of for 90 to 100 days, your chance of Alzheimer's diagnosis rose to 32%. If you took daily doses for more than 6 months, the risk increased to 84% for taking something that calmed you down, right? So this is why I'm saying let's go the natural route. In fact, the study showed this strong association where you took the 180 doses every day for 6 months or spread it over for 5 years. It didn't really matter. The people who took fewer than 90 doses had a much reduced risk compared to the people taking benzos for longer. That's scary, guys, because I know a lot of people taking this. Next, anti-seizure medications. You don't have to have epilepsy. This is the scary part. You don't have to have epilepsy to be prescribed phenytoin and Dilantin. You could have mood disorders, bipolar disease, nerve pain, or mania. Other examples of drugs in this category include Topamax, Depakote, all these things. But you know what I mean, anti-seizures. These drugs work by interfering with the central nervous system signals. This means you can't get the proper nerve flow, which in turn causes memory loss. Uh-oh, guys, this is what I'm talking about. Sleeping pills is next. Ambien, Lunesta, and Sonata make you sleepy, which may be good to a point, but when you have amnesia or can't remember where you are driving, it's less than ideal. These drugs interfere with your ability. This is why we said sleeping pills. This is not the first guy who said sleeping pills cause Alzheimer's. I was listening to a sleep panel, and I told you guys about that already. And they were talking about non-REM and REM. And during the REM, during the REM stage, there's 4 stages, but specifically stage 3 and 4 is when the toxins in our blood, in our brain, get released. And when we take a sleeping pill like melatonin, it doesn't release those toxins in the brain. That specifically happens during the REM stage. And with the pool of those toxins in our blood, setting in there, that's what's causing the Alzheimer's, because the detoxification. When we sleep, we detox. God created sleep, beautiful sleep for us, because He knew it was the best thing for us. Okay. Um, and melatonin, we produce it, the natural one, but taking it in pharma form is not the same thing. So these drugs interfere with your ability to remember new things, and while they do help you fall asleep a few minutes faster, they also stop you from remembering how hard it was to fall asleep or if you were sleeping poorly. These drugs have not been found to help with sleep maintenance, staying asleep, only sleep onset, falling asleep. They are also addictive. So for you guys who think melatonin and other are thinking is not addictive, later on you will need bigger doses. So last night, in order to sleep, because it was hard, I diffused lavender. I put lavender on my under my feet and on my chest, and then I took Serenity, which is lavender in it. So I hit it three prong because, with all the things happening nowadays, I just needed, it's hard to sleep when my mind is racing. And as much as I try to breathe in and out, it's hard, guys. It's hard. Very, very hard. Okay, last one is drugs for incontinence. Overactive bladder is common in elderly and is treated with Anablex, Deltrol, Samtura, Ditropan XL, Oxytorol, and Mymerbertrate. These drugs work to stop acetylcholine, again, from acting in the body, but learning and memory need acetylcholine. But what's the bottom line here? You'll have to decide for yourself, but perhaps it's that just about any medication you could be prescribed has the potential to interfere with brain functions. Your brain is a victim of prescription medications. There must be natural alternatives for some of these that don't have these types of risks. What time is it? 8:59. So on Friday, I will touch up on when cures. That's chapter 5, which I'm reading, titled oh my gosh, what does your brain need? That will be on Friday at 4 o'clock. Please join me. Let me just take a quick photo here. Okay, so there. And thanks for joining and listening to chapter 3 of this book that I'm so excited about. If you guys have any questions, I'm happy to answer. I'm here to just share, because also the more I share, the more I remember. Because with anything that we're trying to read, that's why I'm trying to teach my kids, is when we're trying to read something, do it so that you're going to teach it. Because when it matters to you, it will, and you're preparing to actually teach the thing, it will stick in your brain and you can utilize it even more. For you guys, thanks for joining Monica. If you guys want to click, I'm going to save this as I save all my talks in IGTV. Just click that so you guys can check it out. But we're going to talk about the solutions on Friday, 4 p.m. Please join me too. Normally, I have my coffee in the morning and I have my tea at 4 p.m. Always bulletproof, because the more fats for our brain to keep thinking. And I have 6 kids and I'm homeschooling some of them and online. The rest are online schooling. 2 in college, 1 in high school, 1 in junior high, and a 6th grader and a 3rd grader. So there's a lot going on. So I need to be up and Primo Supremo. And learning about this is just so interesting. And I think everybody should get to know about what's in these books. And I love sharing. It's free, and I love my friends and my family, and I don't want them to suffer any further. Instead of taking melatonin, lavender, and lavender's like what? I don't know, $20 or something, right? And it lasts me for months and months. So, being budget friendly, since we have a family of eight, including the big dogs, I really need to go the natural route and the more budget route, as always. All right. Thanks for joining me, and happy Wednesday. All right. Bye. Bye, guys.